You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. No more traditional dentures, according to my first guest. He says no more dentures. Get a fixed set of teeth in as little as just a few appointments. With us, we've had him on the show before, an expert on the topic, Dr. Steve Brown. Dr. Brown, welcome to the program.
Great to be here. Thank you.
You know what I like about you? We've had you on the show. You're very passionate.
Yes.
You love this stuff. This is all you do, right?
This is all I do.
I mean, all you do are these implants.
I've been doing it for years. I focus my practice on it, and there's been tremendous changes over those years and before.
Well, you're kind of a pioneer, and people need to know, real interview, I'm not on your side here. I'm not trying to be on your side, but you are kind of one of the pioneers.
Yeah,
in the small diameter mini implant.
Yeah, in that area, you're right. In that, what we've known for years that they work is now verified. It's undeniable. It's scientifically validated with study after study after study.
It's safe. It's effective.
It's safe. It's effective. It works, and so it's something that a lot of us have known for a long time, but now more and more people, and it's now industry standard. It's mainstream.
In the world of dental implants, what's changed over the years from when you first started doing it to now?
Well, a lot.
Why is it better now?
Well, there's a lot that's changed. I mean, there's a lot of people that still like to do multi-stage implants where they like to do a flap, they do a surgical procedure, and they hunt around for the bone, they dig around in there, they place the implant. There are occasions when you have to do that, but a lot of them only do that. And so that takes a lot more time, it's a lot more expensive, and it's more uncomfortable. The more trauma that you give the body, the more discomfort. So those are some big changes. And then other changes are, at least in my practice, when I first started doing the implants, I was using a panoramic film, which a lot of people are still.
You mean like a standard X-ray?
Yeah, a standard X-ray, and it's a two-dimensional view, and it's got an inherent distortion in it, and a lot of people are still doing that. I don't know why.
A lot of people, meaning dentists,
a lot of dentists
just taking regular X-rays.
Yeah,
okay.
a lot of them are still placing implants, but you know we're placing in 3 dimensions of bone. So it would be nice to have an image of what the exact shape of that bone is. So that's one of the changes in my practice. I have a cone beam CT, so I actually can see the 3 dimensions of the bone.
But how does that make the surgery any better? I mean, it seems like an obvious question, but as far as patient satisfaction.
Yeah, why would I want it? Well, because I can be more precise. I can be a lot less invasive. And what precision means in implants is less trauma, more precision.
Less cutting to the gums?
Less cutting to the gums, less cutting of the bone. Also, with that cone beam CT, I can evaluate the bone. I can evaluate the bone and relate it to the restoration of the teeth that we're going to put in there and find out the best bone that's available. And then I can actually place the implants in that location. One other piece of technology that I have that I'm really excited about, right now I'm one of only 5 dentists that have this piece of technology. I can actually...
5 dentists where, in your town?
In the United States.
Oh, really? Okay.
5 dentists in the United States. With this technology, what I can do is I can see exactly where I'm drilling, where I'm placing the implant as I'm doing it. So without that technology, every single time I've placed the implants, to some degree, I'm blind. I'm placing it where I think it should go. So with precision means I can have less trauma. Okay. I can be more accurate in what I'm doing, and it's safer. Less trauma means more comfort. So now, what I'm doing, let me set the stage here. What they're doing, I'm doing something that's kind of analogous to what they're doing in heart surgery. Years ago, they used to do open heart surgery. Everybody used to say, hey, I had open heart surgery. Now, because of the technology that they have, they can monitor where they're going as they're going by looking at a screen. And by looking at that screen, they can see exactly where they are. So they can make small incisions. They don't have to crack open the chest. Well, I can do the same thing in dentistry. I can see exactly where I'm going. I don't need to open the gums.
So you're looking at a monitor?
I'm looking at a monitor, and I'm watching exactly where I'm placing it as I'm placing it, and it's accurate to within a millimeter, less than a millimeter of margin of error, and I'm seeing it real time. So if there's something that I want to change or adjust or manipulate just slightly, I can do it real time.
So it's going to take, it's a little trickier or technically demanding for you.
It's a little more technically demanding for me, but I think the benefits of what that allows me far outweigh the technical demands on myself. And instead of, in the past, once I placed an implant, the only way I could know where I put it is to take a cone beam CT afterwards. You know, I know where I thought I put it, but I take a couple beams, there it is. Now I can place it and I'll know exactly where it is.
While you're doing it.
While I'm doing it.
In real time. So
in
it's live.
real time. In real time.
So because of that, I'm trying to pick up on why it's better. Obviously, it's more precise. So it's less downtime for the patient, potentially.
Well, yeah.
Or less pain.
Well, sure. If I can, anytime you can be gentle with the body likes it. The less trauma that I put the body through, the less discomfort, the less healing time, the better off we are. I mean, that's why medicine has gone to minimally invasive procedures.
You say there's only like 5 guys doing this in the U.S. Why aren't more doing it?
Well, I think that a lot of them think it's too expensive to do it. I think a lot of them don't want to take the time to learn another procedure.
Okay.
And you know, I'm sort of fanatic about all this stuff. What I'm constantly doing is trying to come up with a better way, a more precise way.
Your wife said in the green room, she said he's always looking for a way to make his job easier.
To make it.
And when I first heard that, I thought, is that really a good statement? But then you elaborated.
Yeah, it's not only to make it easier, it's to make it better. You know, one of the things that we find in life is if we can simplify things, if we can be more precise in things, then we're going to be more predictable. And so all these directions that we're going, that I'm taking, are to make the product more predictable, the procedure more predictable, and more precise.
Do you think you can make a better bite, because we're talking about, you know, small diameter implants. We're talking about taking a denture wear and giving them a fixed set of teeth that are, you know, fixed in their mouth. They can eat, they can chew, and you're saying that if you're going to do it, I don't want to put words in your mouth, go to somebody with a CT, go somebody that potentially has this new technology, and ask them. Do you ask them, hey, are you looking at this real time on a monitor?
Well, yeah. I mean, and what you're saying, beyond just placing the implant, what this technology allows me to do is very unique. I'll be actually the first in the world that's mating that technology to CAD/CAM technology, which basically allows me to design your teeth on a computer very precisely. I can place the implants very precisely now. So I know where I'm going to place them because I've designed the plan. I can place them and I can execute that plan, and I can see if I've executed it real time. And then I can take that technology and I can make a prototype, your teeth, that will fit those implants at that time, and I can give you all that, and you can now go out and test drive that product. And we've had a very...
The teeth. So
the teeth.
You could test drive the teeth.
You test drive
so
the
everything's done
teeth.
on a computer, made on an in-house milling machine kind
In-house
of thing?
milling machine. We have an in-house milling machine. It's it's a very...
So the surgery's done on the computer?
The surgery's done on the computer. The design of the teeth are done on the computer. So we have, instead of, you know, typically what they're done is you pour up all these models, and there's distortions in models, and there's all these inherent distortions that happen. I mean, it's just what happens. It's just the physical nature of those products. But what we can do by going digital like this is we can be much more precise, and what that allows me to do is come much closer to giving a patient what they want.
Faster?
Faster, more predictable, and not only.
What do you mean predictable? Keep saying that.
Well, I mean, things can go wrong. We all know there's nothing that's 100% in this world.
You mean they could fall out?
Oh, they can fall out. Yeah, you can place them in a place that's not ideal. You know, things can.
But that's
can
a small percentage.
It's a very small percentage.
Okay.
But we're constantly striving to do better. I mean, if the percentage is 5%, if we can do something that will improve it and maybe take that percentage to 2% or 1%, well, that's what I'm here to do. That's what I'm committed to do. Whatever we can do to make our job more predictable, better, give the patient a better product, come closer to giving them what they want, what they hope to have. You know, there's always this communication issue of what it is that they want to have. With this prototype, I can put it in their mouth. They can see it.
Like try it out.
They can try it out. They can kick the tires. They drive it around the block.
Will it raise your prices substantially?
No, I won't have to raise my prices because I'm going to be more predictable in what I'm doing. And people are going to drive from all over to come get this procedure done this way.
Because nobody likes going to the dentist. Is that right?
Yeah.
Do you hear that? No offense, doctor.
I've heard that a couple of times.
Okay. But you do still hear that? They say no offense?
You know, the great thing about doing the implants is I rarely hear that because they're getting what they want.
But I want to make sure we get this right. And again, you know, this is, you know, I'm not trying to side with you, but the way it's normally done, because people don't like going to the dentist, that normally they go to one person for the surgery, then they go to another person that puts the teeth on top of the teeth, then they go to another person that does the imaging, right? And then the teeth are sent out to a lab, they make the teeth, and everybody gets together. Is that true, what I just said?
That is typically how it's done. That's exactly,
okay.
Exactly.
But how you're doing it is what? It's all under one roof.
Yeah, well, exactly. What we're doing is we have all the lab that we need under one roof. We have 3 lab technicians with tremendous experience, and we have all the we have the cone beam technology right there. So I'm going to get I get the most information.
They make the teeth. They've got the imaging right there.
We make the teeth. We have the imaging right here, right there. We can mill the teeth right there. And so we have, what's nice is if I want to make a change, if I want to make an adaptation, I can bring the lab technician in. I'm not going to have to send the patient somewhere else. I'm not going to have to send the case somewhere.
And better results, you say, because you have a lab right there.
Well, yes, it helps me to give the best results I can possibly give.
Now, denture wears. Okay, so that's the title of this show. We're saying no more dentures. How big of a problem is this in your area, would you guess? I mean, how many denture wearers, upper or lower denture wears are there?
There's tens of thousands of people with dentures, unfortunately, and there's no one that should have dentures. The standard of care is changing. The age of having to put up with teeth that flop all over your mouth, that come out of your mouth, that you have to cover your mouth or you're ashamed to smile, you can't eat, it hurts. Those days, we can support those dentures with implants, which will stabilize them. They can snap in and out. You can still take them out and clean them, or if you don't want that, you can convert. We can let you know. We can look at the cone beam CT and see if you're a candidate to go into fixed. And if you can go into fixed, then that's the best thing you could ever do, because we can cement
a fixed set of teeth. That's what everybody wants. A full arch of teeth.
A full arch of teeth, of fixed teeth that are made out of zirconium. They don't absorb bacteria. They don't absorb moisture, so they don't inherently stink over time. They are the hardest material.
Because you don't like acrylic. I mean, ideally, you don't like acrylic.
Right. We use acrylic
in the mouth because it could be stinky. I guess it's porous, like a regular denture.
Exactly, like a regular denture.
So you're using, in the best case,
when we do fixed, we use zirconium, which at this point in time, it is the hardest material we can use that looks like a tooth.
So it's strong. It's strong.
It's very strong. It's the strongest thing I can use that looks like a tooth. I mean, I could use solid steel, but nobody wants a metal unless they want to be in a James Bond movie. So you know, we can make it look like a tooth. We can use zirconium. We use denture materials. We use acrylic with the removable snap-on, because we can save people money that way. I mean, it's less expensive. It doesn't last nearly as long, but it is a less expensive option.
Now, I want to go back to this technology where you're doing it like an endoscopic surgery or whatever. You're looking at a screen while you're doing the implants. You say it's more precise. What would the oral surgeon say about this?
Well,
specialists. I mean, what would they say?
Well, I think that they love precision as well. And so as they learn more about this technology, they're going to jump on board. Those oral surgeons are going to want to do the exact same thing.
So that's your hunch? They'll love it.
I think so. I mean, if you can do something with more precision, more accuracy, more safety, I think that's something that we all shoot for.
Now, doctors will watch this show, okay? They don't like to admit it, I always say. They watch the show, and they will be skeptical, primary care physician, medical doctors, other specialists. What do you say to them about what you're doing as far as helping denture wearers and the small diameter implants?
Well, the first thing I say is they work.
Okay.
They've worked for a long time, and now we have long-term scientific studies. One of the most recent ones came out a few months ago that shows a 9-year study. It verifies that they work. Thousands and thousands of them placed, something that we knew all along, they work. So what I would encourage is for them to offer this option to patients.
Okay.
Because it's affordable, it's less invasive, it's going to be more comfortable for the patient. It's a tremendous option that I hope that they make available to people.
Because you're a big fan of traditional implants.
Sure.
Right?
They're great. I place them. They've worked. They've got a long-term track record.
That this should be an option to people that can't afford it.
Obviously. If you don't provide this option, there's probably about, according to Gordon Christensen, about 70% of the people that need implants that will never get them. So it's really important. Those people deserve to have implants too. They deserve to have teeth they can chew with. They deserve to feel good about themselves, their smile. They deserve to be able to eat what they want to eat. And to not offer that, I think is a mistake.
But what took especially for the denture wear, okay, you say they're afraid of the dentist, they're afraid of pain. They went through a lot before they became a denture wearer.
Yeah.
You're doing guided surgeries now. I'm calling it guided. What's the lingo? What do you call it?
Well, it is guided. It's guided. It's
real time on a.
There are guided surgeries that are, by definition right now, what's being done, if you're not using that technology, is you're making a stent that has a little hole in it, and you you drill through that hole. So you put the stent in the mouth and you drill through that hole.
That's the best way to go.
That's what's called guided. But
Isn't
what
that the
this
best way to
does,
go?
no, this is even better, because even when you use that little stent with the hole that you drill through, you can't see exactly where you're going. So you're still poking around, you're hoping that plan's perfect. Well, with this technology, I can see if that plan was the best, then neurosurgeons would use it. Then we'd be doing that with heart surgery.
But aren't they pre-planning? That means these stents,
right?
And I've interviewed some guys with this.
Sure.
It's done on a CT. It's made based on the bone they have in their mouth. So when they poke it through those holes, pretty precise, right?
Well,
or wrong? Am I not understanding it correctly?
Well, it is pretty precise, but it's
But
still.
why is yours more precise? That's the part I'm not getting.
Well, let me try to say it this way. I've used those stents as well, and they rely on the model that you use. You've taken an impression,
Okay.
you've sent it usually halfway across the country or the world, and they've made a stent to fit that model. Well, you're relying on that model to be the exact shape of the teeth that you put it back in the mouth.
Got
Now,
it.
we know there's distortions in models. That happens all the time. And you're relying on that it goes into place perfectly. And if it does go into place perfectly, and if it's the exact same shape of the teeth as the model in the teeth, then yeah, you're going to have great accuracy. But what this does, it's real time. You put it in the mouth, you take the cone beam CT.
Is it called fluoroscopy? I mean, what is it called, by the way? I mean, what is this?
It's basically called image navigation.
Okay.
And they're
So now
using,
you know exactly.
Yeah, because
Real time.
First we put that stent in the mouth, then we take them over. We walk them 10 feet over to my cone beam CT. We take the cone beam CT. It's stabilized in the mouth. We take the cone beam CT. Then we go right back and place the implants. So we're not taking a model, sending it halfway across the country or the world.
And you're looking at it.
And I'm looking at it real time. So there's nothing, and if I need to alter it, if I need to change it just slightly as I'm looking, if I want to change the angle just slightly, I can. I have that freedom, I have that ability. With the other, I don't. I'm still doing it in some way I'm doing it blind, because I can't see where it's going. This is the only way you can see where it's going. And they do neurosurgery that way, they do heart surgery that way.
So with the patients, okay, the no more denture crowd, right?
Right.
It makes for a lower downtime, maybe a less
Right.
painful
Right.
outcome?
Exactly.
Is that
exactly.
right?
Yeah, that's what it does. It allows us to be more consistent, to be more precise, to be less traumatic. We're not hunting
And
around
it doesn't
the
cost
tissue.
more to go to a guy like you.
No, it doesn't. Not at
Okay.
all. In fact, what I hear all the time is that I'm less expensive than their alternatives. I hear that all the time.
You do?
So all the time.
Do they ever say, that's it?
Yeah, a lot of times. And they'll tell me, wow, this other guy told me it was going to cost $35,000 or $75,000, or I've had cases where we're a third, even for a removable denture. I've had plenty of cases where they're going to do a removable denture, snapping onto implants, and I've had plenty of cases where I'm a third of that cost. Now, not always, but I've had cases, and that's crazy. If I'm doing a removable denture and I'm a third of the cost of somebody else doing a removable denture. But yes, I
So
get
you're
it.
convinced, by the way, that this has picked your game up a notch, this guided surgery that you're doing on a camera.
Absolutely. Absolutely, I'm convinced. And one of the things that I love about it is it gives me predictability. It gives me the ability to be very precise, and especially if I'm trying to do a fixed roundhouse. That's a very
What does that
complicated.
mean, fixed roundhouse?
A fixed roundhouse is make a full arch set of teeth, like a full upper arch set of teeth. If you need the whole upper replaced or the whole lower replaced, what this allows me to do is to be very precise from the very beginning to the very ending of the process. And it helps me to give you what you want. I mean, I have to be the engineer.
So the patient may not even appreciate all this technology, but the behind the scenes is, it's a safer way,
Right.
more precise way, less cutting of the gums.
It gives me the opportunity to be less traumatic, less cutting. That's what they'll really like. They'll like the precision. They'll like to have input on what they're.
Do you ever have patients say, because doctors tell me this, when it's all done, they go, that didn't hurt at all.
Yeah.
I mean, you have people say
we hear that all the time. We hear people say, wow, I was worried about this. I stayed up all night worrying about this. And that's it? That's it? I have people say, just last week I had somebody say, look, you placed 3 implants. I didn't even know you did. I didn't even know you did.
You're done, they'll say?
Yeah, exactly. I usually have them watch a movie. Usually they take a little sleeping pill. It doesn't put them to sleep. It helps them relax.
Where are your TVs? They're on the ceiling?
No, I don't put them on the ceiling. I have these they love these periscopic glasses that I have. I don't know, everybody loves these things.
Really?
And so they're laying down and the TV's on the wall because I just don't ever want to take the chance the TV falls. So
Oh,
they're looking at the wall, they're laying down, they're looking. They think first they think that's cool, and that it helps them to focus on something else. And so I'm doing the procedure, and when I anesthetize them, I use a couple of different types of anesthesia. The first kind of anesthesia I use has a neutral pH, so it's very comfortable. And then I use another kind of anesthesia after it's pretty much got them numb. It gives a more pronounced numbing effect. It's got a smaller molecule, so it penetrates the bone better. So we get them numb, and we try to do that very comfortably. And then when I'm placing the implants, again, you got to remember it's minimally invasive. I rarely make incisions. I rarely have to wrestle the tissue. I rarely have to dig around. I can be very precise.
And you could be old to have this done. I mean, you say the 94-year-old. I love the story where she drove herself home after the procedure, right? You don't recommend that?
No, I prefer. It shocked me that she was driving home. I wish she wasn't driving home, but she did. No problem. She came back the next day for us to check on her. All smiles.
Is your secret goal? And we're out of time. But is your secret goal? Maybe this isn't your goal. You'd like to, but you want to wipe out all dentures?
I would love to. I would love to.
What part of Texas are you from? I'm in the town.
Dallas-Fort Worth. I'm in Fort Worth.
So you're Fort Worth.
Dallas-Fort Worth.
No more dentures, Fort Worth. I mean, wouldn't that be ideal?
Oh,
Do you think if they knew how good it was to not have the adhesive and stuff, they would all do it? I mean, they'd literally be lined up if they knew how good or how affordable it is?
No doubt.
Do you believe that?
No doubt. Oh, no doubt. If they could somehow understand what it was like to actually have those teeth anchored to implants, and the earlier in the process that they could do that, I mean, not today or yesterday, I mean years ago, the better off they would be. Each one of them. And I've had so many people come and say, I wish I'd done this years ago. I struggled for years.
But these are people that are dating and they're kissing, and people don't like doing these things with dentures in their mouth.
No.
So get rid of that loose-fitting denture. I mean, ideally, get a fixed set of teeth. Somebody watching this denture work, in a perfect scenario, 75-year-old, right? Pretty good health, comes in. What's the absolute fastest, if everything works out right, they can have that fixed set of teeth? If everything works out.
Fixed set or removal set?
Fixed set.
The fixed set, the absolute fastest is probably about a month. But
so 4 weeks from today.
4 weeks from today. But here's the thing. What we want to do, they're going to have implants, and they're going to have an intermediate. They're going to have a provisional restoration,
like a temporary set
They're going to have a temporary. So what we want to do in that interim, we actually try in the prototype. And so what we're really trying to do.
So they go home and test out the teeth.
And what we're really trying to accomplish during that time is not so much the absolute fastest. I mean, I could probably do it in a couple of days. But what I want is for those teeth to fit their mouth.
Because you're a cosmetic guy in a way.
I'm a cosmetic guy. And there's a lot to this. You want it to feel right in there. And I want to be able to verify it. I mean, just because I can do it in a day doesn't mean that's the best way to do it. So, yes, I can stabilize the teeth, and I do stabilize the teeth in a day. But to get that final restoration, we want that to be as close as we can to them being thrilled with it and me being thrilled with it. And that takes working out a lot of details, and I like to verify it. And the only way you can verify it is for there to be a little time.
To give them a good look.
To give them a good look.
Are there a lot of people, denture wearers, because I know a few, and I never hear a complaint out of any one of them. Okay.
Well, they're not going to tell you. They're going to tell me. They're not going to, a lot of them don't tell anybody.
But are there a lot of people, let's say in Fort Worth, that can't chew, can't eat, and that would be great candidates for this?
Oh,
could be eating broccoli or whatever.
There's too many. There should be none. There's too many. And that's one of the reasons we do these small diameter implants, because we've made it affordable. People don't have to live that way. They have an alternative. They just need to know the options out there. And I hope that whatever dentist they have, whatever dentist they see, if they don't go to one, they see this, and they at least come in and just talk about what's possible. And they can talk to their friends that are, a lot of times the patients that we see, we'll talk to them about it. They can ask them what's possible, learn their options, but I wish no one had to go through the traditional denture.
Do you find that, let's say, one person comes in and then they drag their partner in? Or does that happen?
I see that all the time. I have a trail up here. One person comes in, they tell this person, they tell this person, they tell this person. We see that all the time. Oh, I saw somebody in the store, and I said, boy, they had beautiful teeth. And they said, well, I went to Dr. Brown, and he gave me these teeth. And, we see that, we hear those kind of stories all the time. So, yeah.
Now, for people, and I know this is a huge topic, nursing homes. A lot of these people can't eat. One of your pet peeves.
Yeah.
And now it's affordable to help out. I have a mother in a nursing home who can't really eat. What's your message to the caretakers of these people?
Well, we see a lot of people,
and we are out of time. And I want to be
we
respectful
see people
for
in the
this.
homebound situation, in the nursing home situation, and if we can improve their life by giving them secure teeth, let's do it. If they're a candidate, let's do it. Because as long as they're on this earth, they'd like to chew, they'd like to eat, they'd like to enjoy those things, they'd like to communicate with their friends. I mean, it's the longer we get down this trail of life, the more senses we lose. One of the last pleasures, physical pleasures, is eating and enjoying that. And so this is something as a dentist that we have the opportunity to preserve for people, hopefully for every day.
Do you ever do like Alzheimer's patients, things like that?
Yeah, absolutely. If they can get them in a car, if they can get them to my office, bring them in, let's talk about what the possibilities are and see how we can help make their life better.
Okay, we're out of time, but final message, again, somebody's skeptical, they think they're too old, they're worried about pain, they're worried about cost.
That's
what do you do? What do you tell them?
Just come in, let's talk about it, take a look at their situation, and there's so many people that think that and have been told that, and it's absolutely wrong. So come in, we'll take a cone beam CT, we'll give them their options, we'll decide, we'll listen to what they want to accomplish, and then usually, most of the time, we can help them accomplish their goals.
How long from the time they walk in your office, how soon before you can tell them you're a candidate? You can do this.
Usually within about a minute of the time I take the cone beam CT.
Is that right?
Yeah, I talk to them first, and then and I usually what I do is I talk to them, I give them an idea of what I think can probably be done without a cone beam, because I've done so many of them. I say, it's generally going to cost about this. If they say, God, that's awesome, let's do it, then we walk over, we do the cone beam CT, and I can tell them within a minute, here's what we can do.
Good. Good.
It doesn't take
you have
hours.
photos on your website, things like that?
Yeah, they can go to our website.
I want to thank you for coming on the show.
Thank you, Randy.
Always a pleasure. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or direct a friend to it, you'll probably have it on your website. We're going to have it on ours. Just put in Dr. Steve Brown or Mini Implants Texas, and you'll find it that way. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.